Mental Mass here at Kinetic Health. Today we'll be talking about mobilization of the spinal cord and the sciatic nerve. Basically, we'll have Sam turn here just for a sec so you can see her back. So when we're talking about the spinal cord, we're talking about, base of the skull at the brain, coming all the way down into the low back and the sacrum, the tailbone area. Branches off to the side here, you've got the sciatic nerve, a plexus. The nerve runs down through the thigh all the way down to your foot, basically. So it's quite a broad area. This area, it's involved in low back pain, mid back pain, hip, leg problems. The sciatic nerve itself is it innervates all the musculature here in the back of the leg, skin. You've got sensory branches, motor branches. Quite an interesting nerve involved in a lot of different conditions that we see here on a daily basis. So have Sam turn once again. So in mobilizing the nerve, one thing that you really got to keep in mind is that the spinal cord itself is housed within the spine, the column, the bony architecture. So we can't actually get in there with our hands and mobilize the area, but we can do that through motion. So by having Sam bend forward here at the waist, you can actually see she's elongating her back. She's stretching out the spinal cord. And it's actually considerably longer in this position versus coming back and standing up straight. Now it's in a short and contracted position. So when we're thinking about the exercises and the type of things that you're going to be doing to mobilize the nerve, you got to keep in mind by changing body position, length of tissues, you're creating tension or glide in that nerve. And that's key to some of the exercises that we're going to go ahead and explain now.
Hello, I'm Dr. Brian Abelson. One of the first exercises that we're going to go over is actually a cat-camel stretch. This is one of the first things we have our patients do first thing in the morning. You're lying down at nighttime. Essentially, we're a lot taller actually in the morning than we went to bed at the end of the day because our fluid from our body starts to rehydrate the discs of our back. So what we want to do is we want to make sure that we basically get some motion into the spine. At the same time, floss the nerve roots all the way up and down from the cervical spine, thoracic spine, low back. Sometimes we'll have patients, when they have low back pain, focus a little bit more on bending up, taking it up, and just bring it down. Nice, gentle motions. We don't want to go too far in either a flexion or extension position because you want to just get some nice motion into the spine, and this has the great effect of flossing or moving the nerve roots that come out from the spinal cord so that we loosen up the low back. After we warm up for a while, we're going to put a lot more motion into this. And in terms of flossing, we're actually going to bring the mid back up a lot higher, and then we'll start getting some neck motion into the flexion extension actions of the cat-camel exercise. So now we'll get Sam to really bring that up high, taking it down, and we'll also start putting some neck motion into this as we go back and forth. As we move back and forth here, you see how we're basically mobilizing the nerve roots from the cervical, thoracic, and lumbar spine. This is a great exercise I highly recommend. But first thing in the morning, make sure you're going really gentle with yourself. Back and forth a little bit in terms of flexion extension. Don't overdo this too much. First thing in the morning, 15-20 repetitions, nice and easy. Later on throughout the day, after you warm up, and you want to floss the nerve roots all the way from the cervical, thoracic, and lumbar spine, 15 to 20 repetitions. Again, very gentle, easy motions.
A great exercise specific to the sciatic nerve is a flossing exercise. So we've got Sam in a seated position. She's going to bring the knee up slightly, and the key is to extend the leg to straighten it and make sure you're pulling the foot back. Now I'm just going to have Sam relax here for a second. I should make a keynote. Basically, if you're in acute pain, if you have someone that's really in pain and suffering and there's a lot of pain down into the leg, you want to start out slow, and your goal is to floss the nerve. And we can achieve that by having Sam move her head back. So we're going to bring this knee up, we're going to straighten the leg, pulling the foot back, and by having her slide back with her head, we're creating a gliding motion, a sliding motion, trying to relieve the nerve and to create motion between the tissues. Once you've done that for a while and you're starting to have less pain in the leg and in the back, then you can start incorporating more of a tensioning move. So a tensioning move is basically the same. We're going to bring the foot back, but this time we're going to bring the chin down. And now we're creating a tractional force, a pulling sensation. So we're tethering the nerve at the bottom and at the top, creating a lot of tension along that nerve and stretching it out. And if you're comfortable with both motions, ideally you'd like to incorporate both. So you could do 5 in this direction and then 5 with the head going back. But please remember, in the beginning, there's a lot of pain in the leg, especially with sciatica. And so you want to make sure you're creating a gliding motion, and that incorporates bringing the head back. Yeah, perfect, good.
One of the things I would like to mention with sciatica is, if you have severe pain, please see a medical practitioner. This is not something you want to deal with on your own necessarily. There are some red flags I'd like you to be aware of whenever you have sciatica. That being, if you are coughing, sneezing, bearing down on stool, and you notice the pain is just shooting down your leg, you need to see a practitioner. The real key red flag is if you start noticing changes in bowel and bladder function, you need to go right in. I mean, this could be a medical emergency. In most cases, it's not. And most of these conditions do resolve quite well.